Basically, we acted as a Band-Aid to our healthcare system in helping our communities protect them from COVID-19. My name's Adele. I'm a registered nurse here at First Nations Health and Social Secretariat of Manitoba. First Nations Health and Social Secretariat of Manitoba is the organization who we work under. We are a intensive home visiting program.
Can you tell me what you love most about your job?
Well, families, empowering families, working alongside, partnership with our communities and our families. I'm First Nations. We work in First Nations communities, and just being able to watch families grow. We need to break that cycle of the attachment and bonding that we lost. And this program, we find it's based on research that it works. Being from northern Manitoba and communities are so dispersed, and just my own personal experiences as a young mother in a small town, that I just wanted to give back and care for our communities. Manitoba, I think, is unique in geography. And when we work in First Nations, we have 63 throughout the province, 7 tribal councils, and programs are not in every community. Some of our reserves are close to the bigger centers. When you go up north, further north, it's fly-in. So our nursing stations, you have the nurses start at 8:30, acute care 8:30 to 4:30 or 8:30 to 5. Doctors fly in and fly out. Some stay, some don't, based on their contracts. So emergency is basically a nurse in the middle of the night basis. Doctors won't be there. And it's medevac. And with shortage of our nurses, that the public health kind of gets put on the wayside. Yes, our immunizations get done, but there's so much involved in an immunization clinic for a public health nurse. So the access of care, I don't think, is there. And then also if you're status or non-status, there's issues around coverage, medical service coverage. So March 17th, the worldwide pandemic was announced, and we're all sent home. We packed her up that day and went home, and our organization worked very quickly on communication. And as nurses at Finisum, our organization, we got to call our partners. What are we doing? What's going on? We tried to talk to the nurse up in Shamattawa, to Dooley Lake. We were losing connection on our phones. And this is our healthcare system. This is how we operate, through phones and emails and faxes. We can't get through because of connectivity. Like, this is ridiculous. Like, we can't have a great meeting conversation of what we're doing as healthcare providers. So yeah, it was a good 18 months. I would say 18 months to 2 years that it was all hands on deck in focusing on COVID-19. Basically, we acted as a Band-Aid to our healthcare system, in helping our communities protect them from COVID-19. Tests were sent to community to test for COVID-19. We needed 2 nurses to work the lab. So we'd gather, the samples, and then we test them all day. We'd take a break in the afternoon. Then you'd be the swabber. So you would, work that. And then this alternated every day, or where you're comfortable. And we even went out in full PPE door to door, and we're doing swabs through the doors and taking them back to the lab. One community, we're with the military, and we followed the military nurse around and helped them. So we're just going in and just doing mass testing, bringing them all out to Winnipeg for isolation. So this was how, and we're dealing with our 63 communities. So the pool's getting smaller, nurses are getting burnt out. And in our communities, we have a lot of families that either live with 10 or more people, 10 or, 3 or 4 families within a small house. So if one family member contracted COVID-19, we need to bring that family out to isolate. There's nowhere in the community to isolate. And they started the AIA, alternative isolation accommodation. So they got a couple hotel rooms in the city to bring people out for isolation. Alternative isolation accommodations was a huge project for our families that were brought out for isolation. We operated in a more culturally sensitive way. It almost brought back like the residential school feeling for a lot of the families being taken from community, placed in a room, given food at the door for breakfast, lunch, and dinner. So they worked tirelessly on how to provide the comfort and care traditionally and holistically. So they were able to set them up for teams to do ceremony, funerals. It's our culture to have mass gatherings for funerals. So a lot of coordination on how to set that up for a family to, grieve. Diabetes is a pandemic or an epidemic in our communities in Manitoba. Manitoba alone has got the highest rates of diabetes in our First Nations people. We do have within our organization the Diabetes Integration Project. There's 3 teams and they travel to community and do EGFR, like kidney testing. The Diabetes Integration Project needed a director like yesterday. So I started that role as director in it's a huge project. And at the same time, a pandemic. Our health centers are busy with multitude of chronic conditions, and we don't have the diabetes programs that we should in the communities. So things just get left untreated and misdiagnosed, and the lack of quality care is gone. We're finding more and more amputations. Blood sugars are high. You want to delve into racism with our governments because the high numbers of diabetes for First Nations and the wound, the amputations are triple. It's like we're not being heard. Took a toll on me being in that role. I thought I was ready. It is a huge role. It's an important role. And I didn't want to be the one to mess up such a great program. I was just feeling that lacking confidence as a nurse. Maybe it was because of burnout that you feel vulnerable. So I made that decision to step down. I was busy with home, worried about home. My mom's getting over cancer. They lived far away. I mean, we all went through, everyone goes through this in a different way. And so, stepping down, I just felt like a failure that I couldn't do such a position. But, the team says, no, Del, you did fine. You just didn't have a chance. You just didn't get the chance to do it because of having to deal with the pandemic and, making sure our families were taken care of, through our nurses that were employed here and in the program and then our home life and doing deployments. All the reports that are need to be due, worried that government's going to take our funding back. Nurses constantly moving around because not happy anymore, and I guess I was one of them. Our workforce is in trouble. We have high turnaround, whether it be home visitors or nurses, doctors, therapists. So how are we preparing now, us regionally, how do we prepare our nurses and our home visitors when they enter homes? What are they going to see? What are they going to find? What do we do? So we're doing a lot of strategic planning on our end on how to support and it's heartbreaking, but it's reality, and I love this organization and what they stand for, making our communities better, and we're a strong voice. So that's what I'm hopeful for in my career and where I work. We can get through leadership, we can get through the government, we can move forward for our people. We ran our own communities until before time, and we just need to resurface that.